Okay. So are we seeing more cases because we're doing more testing?
Yeah, I think we're absolutely. Definitely, testing has become increasingly available over the 2.5 months that we've been fighting this. Kaweah Delta, a little over a month ago, developed its own testing capability running on a couple different platforms. The county continues to test. Sierra View Hospital now has the Abbott ID Now platform, so they're able to do testing. And then the state has established new testing sites in Dinuba and Porterville. So without a doubt, just the more testing you do, the absolute number of positive cases is certainly going to increase. And so I focus less on the absolute number and more on what they call the positivity rate. So what percentage of those that we test are testing positive? So I think that's more of an important number to follow. And so Kaweah Delta, again, since the start, it's hard to believe that it was back in early March that we collected our very first specimen. But we've collected 5,500 specimens since that very beginning. Roughly, say, 560 of those that were tested positive. So we have a positivity rate, at least with respect to the testing that's been done by Kaweah Delta, of 10%. And so that's an important number. As any of you that have been following Governor Newsom's 4-phase plan for reopening the state, reopening counties and cities and other communities, one of the criteria that still is in place, and this is really to move into what they call the second phase of phase 2, is that you have to have a positivity rate of less than 8% for 7 consecutive days, the most recent 7 days. So obviously we're running a little bit high on that metric at 10% versus being below 8%, but I think a lot of you know that it has been disproportionately affected by the significant breakouts that we've seen, not just in the nursing homes, but we had a very large outbreak in Reese Foods. I believe over 200 of their employees tested positive. The meat processing plants that you see in Hanford have had large breakouts. So our numbers really get kind of skewed because of those.
Okay.